Record.
Good morning. I'm Ann Bishop, Executive Director of Texas Public Employees Association, and I'm here today to support the budget request, and I'll echo all the statements that you heard earlier. A couple of points of clarification or support. One is, thank you again for the question on a state employee pay raise. The last cross-the-board real state employee pay raise was fiscal year 2015, and that was 2.5%, 2% rather. In 2016, there wasn't a cross-the-board pay raise, but it was, I give with one hand and I take with the other, because it was designed to offset the 2.5% pension contribution increase. So employees really didn't see a net increase to their pay as a result of it. Inflation has been going on, not just this past year, but it is cumulative and it has been going on. It always goes on. It's just a matter of how much it is. And so it does impact the pocketbook of our state employees. It does impact hiring and recruiting. You asked about the number of applicants. Thank you for that. But they're not always qualified applicants. So you can get a large number of applicants and they're not necessarily qualified or meet the qualifications. So I think that's an important distinction. The other thing is I have to give a shout out for the actuaries just because I have so much experience with Pensions Review Board. When I was at ERS, had a very difficult time attracting an actuary. Actuaries are expensive because there's a lot of tests, there's a lot of education involved, and you can get paid a lot more money in the private sector. So what we had to do was actually develop our own actuary. Now that took 5 years because by the time you take the courses, and this is somebody with a master's degree in math, but by the time you take all the courses and all the exams, it takes a while. So I stress how important some of these positions are just because every agency has important, unique skill sets that they're trying to fill. And even though the actuary is a skill set in the Pension Review Board, and they're also a small agency, so they don't have a lot of backup in this regard, but there are actuaries at the Department of Health or State Health Services. There are actuaries at TRS. There's actuaries at the Controller's Office. There's actuaries all over the state. So keeping in mind, it's not just one agency, but all state employees and salaries that need to be addressed. And I'm happy to answer any questions that you may have. And I appreciate your time.